Hello everyone, I'm Dr. Pulkit Nandwani. I'm a gynecologist and a laparoscopic surgeon practicing in Rohini, Delhi. Okay, so today I want to share some information to you about polycystic ovary syndrome. So what is polycystic ovaries? These days polycystic ovary syndrome is becoming extremely common. It is increasing in incidence. Nowadays every 2 in 10 women will be having this syndrome. Polycystic ovaries are nothing but ovaries slightly larger in size than the normal looking ovaries. The small cysts form in these ovaries which cause some hormonal disturbances. So having a diagnosis of polycystic ovaries on ultrasound does not mean that you have polycystic ovarian syndrome. Polycystic ovarian syndrome occurs only when a patient is experiencing symptoms along with an ultrasound diagnosis of polycystic ovaries. Now, what can be the symptoms that occur in polycystic ovarian syndromes? The symptoms are usually due to the hormonal changes, means that you can either have irregular periods, heavy bleeding, or there can be no periods at all. There may be increase in body hair, increase in facial hair especially, and loss of hair on the head. Then there can be weight gain, patient can become overweight. It can affect the fertility, difficulty in conceiving, as well as oily skin, acne, and can also be caused by polycystic ovarian syndrome. Then there can also be some psychological disturbances. Patient can experience mood swings and depression, all because of the hormonal changes of polycystic ovaries. Now, what are the causes of polycystic ovary syndrome? Cause of polycystic ovarian syndrome is as such not yet known. It is just seen to run in a hereditary fashion. If your mother or elder sister experience problems of this kind, you are also likely to have polycystic ovarian syndrome. Now, other than these symptoms discussed earlier, you can also experience a lot of long-term consequences on health because of polycystic ovarian syndrome. These patients are more likely for having heart diseases later on in life. Very high chances of diabetes and blood pressure is there, and even high chances of uterine cancer, developing cancer of the lining of the uterus. Now, how can we reduce the effects of polycystic ovarian syndrome? As such, there is no cure for the polycystic ovarian syndrome. We have medical treatment, but better than that is to have a healthy lifestyle. Polycystic ovaries respond a lot to just having a healthy lifestyle, which includes losing weight. If a patient is overweight, the first advice that we give to the patient is to lose a weight. Even a minimum weight loss of 3 to 5 kgs makes a drastic decrease in even the appearance of polycystic ovaries and betterment of hormones. So having a healthy lifestyle means eating lots of fruits and vegetables, cutting down on junk food, losing weight in the form of activity, having exercise makes a difference in the treatment itself. If along with that any other medical requirement is that, then we have some hormonal tablets which can be started to cure the bleeding problems, as well as we start them to help the patient to try to conceive. For the long-term effects, just having a healthy lifestyle, having a control on weight, having regular checkups with your general practitioner, having regular checkups of sugar to rule out diabetes or blood pressure, and then annual screening for cancer can reduce the long-term effects of polycystic ovarian syndrome. Thank you. I hope the information was useful for you. If you have any queries regarding that, you can always contact me on Librate.